In the 175 years since Morton demonstrated ether in surgery, anesthesiology has grown and changed dramatically. Here at Massachusetts General Hospital, a small cadre of specialist doctors and nurse anesthetists has grown into an official department of 650 people. And the field as a whole has too.
Anesthesiology has grown and evolved dramatically as a profession over the almost 50 years now that I've been honored to be part of it. I think anesthesiologists have developed just an enormously broad set of instruments and skills to make anesthesia not just safer, but to improve the quality of anesthesia and the ability that allows surgeons and all kinds of other proceduralists to do things they just couldn't otherwise do. They can do operations, they can operate on incredibly sick people because anesthesiologists and the science that they have worked so hard on have enabled that, have allowed that. And boy, it's just no small feat.
As it was in the beginning, MGH has been at the center of those changes, and going into the future, it is poised to remain that way.
You know, I'm excited about the future because I think the future is very bright. I think the future is bright because history informs us that we are destined to achieve a higher level of excellence in patient care.
We have a national, if not international, position of leadership because of the people that have grown up and learned in this department and have gone out and populated other departments across the country and the world. Shayun at the helm of this is a young, very dynamic, creative and brilliant individual. I think is, again, a perfect person to be leading this department at this point in time, working collaboratively with other anesthesia leaders across our system. We will continue, I think, to be the bright star, not only nationally but internationally. And so I think the future holds great promise, and I think this department's going to be a significant part of it.
Among the keys to that future are new research discoveries and clinical innovations, some of which may be just around the corner.
There are lots of things that I think are going to happen over the next few years. We're going to leverage physiological principles to improve the care that we deliver to all patients. And I think outside of that, in the midterm to the longer term, we're going to start using advances in proteomics and metabolomics and whole transcriptomics to really get at the bottom of a lot of fundamentally difficult problems in postoperative care like delirium, to try to really understand how do we diagnose patients objectively, how can we treat patients, and then longer term, I think, how we could leverage this insights to improve post-op morbidity and mortality. So I certainly think the future is bright because we have lots and lots and lots of opportunities to improve the excellent care that we deliver.
As always, MGH is ready to lead the way in that area. Among the hundreds of innovations under development here is the ultimate anesthesia machine.
Digital health, wearable monitoring, virtual visits, and the like are revolutionizing and democratizing healthcare excellence at a breathtaking pace. In our field of anesthesia, from my perspective, the flagship project and holy grail is to succeed in linking physiological sensing of the body status, such as blood pressure or properly measured depth of anesthesia, with drug delivery of gas and intravenous anesthetic agents and vasoactive drugs.
Another exciting avenue is the potential to use neurological information to develop ever more precise drug combinations for anesthesia.
We can imagine a situation where we could have, perfect control of pain, little to no impairment of cognitive function, get rid of nausea and vomiting altogether. And if you think about side effects occur, so for example, like being nauseated, they occur because the drugs are acting in locations where they shouldn't be. So just like we have targeted immunotherapies for cancers, developing more targeted approaches for anesthesia, I think, is really the way of the future.
Beyond research, MGH continues to train the leaders who will chart the future of anesthesiology around the world.
And I'm really excited about that opportunity to really attract the next generation of brilliant minds that are going to help make sure that the care we deliver to patients remain at a very, very, very high standard. We attract the future leaders. We give them the resources to think outside the block box and flex, if you will, intellectually. And I think we've been very, very successful in growing those future leaders and giving them wings to fly.
For 175 years, MGH has been a world leader in anesthesiology. Today, thanks to its culture of innovation, dedication to patient care, and commitment to developing new leaders, MGH is blazing the way into an exciting future.